Tolmetin is an NSAID used to treat acute flares of various painful conditions and used for the long-term management of osteoarthritis, rheumatoid arthritis, and juvenile arthritis. In this video, let's find found. What is Tolmetin? What is Tolmetin used for? Contraindication. What are the side effects of taking Tolmetin? How does Tolmetin work? How to use Tolmetin? Tolmetin is an NSAID used to treat acute flares of various painful conditions and used for the long-term management of osteoarthritis, rheumatoid arthritis, and juvenile arthritis. In this video, let's find found. What is Tolmetin? What is Tolmetin used for? Contraindication. What are the side effects of taking Tolmetin? How does Tolmetin work? How to use Tolmetin? What is Tolmetin used for? For the relief of signs and symptoms of rheumatoid arthritis and osteoarthritis, including the treatment of acute flares long-term management. Also for treatment of juvenile rheumatoid arthritis. Contraindication. Hypersensitivity to Tolmetin or any component of the formulation, patients who have experienced asthma, urticaria, or allergic-type reactions after taking aspirin or other NSAIDs. Side effects: diarrhea, constipation, gas, weight gain or loss, headache, depression, skin irritation, ringing in the ears. Pharmacodynamic. Tolmetin is a nonsteroidal anti-inflammatory agent. Studies in animals have shown Tolmetin to possess anti-inflammatory, analgesic, and antipyretic activity. In the rat, Tolmetin prevents the development of experimentally induced polyarthritis and also decreases established inflammation. In patients with either rheumatoid arthritis or osteoarthritis, Tolmetin is as effective as aspirin and indomethacin in controlling disease activity, but the frequency of the milder gastrointestinal adverse effects and tinnitus was less than in aspirin-treated patients, and the incidence of central nervous system effects was less than in indomethacin-treated patients. In patients with juvenile rheumatoid arthritis, Tolmetin is as effective as aspirin in controlling disease activity, with a similar incidence of adverse reactions. Tolmetin has produced additional therapeutic benefit when added to a regimen of gold salts and, to a lesser extent, with corticosteroids. Tolmetin should not be used in conjunction with salicylates since greater benefit from the combination is not likely, but the potential for adverse reactions is increased. Pharmacodynamic. Tolmetin is a nonsteroidal anti-inflammatory agent. Studies in animals have shown Tolmetin to possess anti-inflammatory, analgesic, and antipyretic activity. In the rat, Tolmetin prevents the development of experimentally induced polyarthritis and also decreases established inflammation. In patients with either rheumatoid arthritis or osteoarthritis, Tolmetin is as effective as aspirin and indomethacin in controlling disease activity, but the frequency of the milder gastrointestinal adverse effects and tinnitus was less than in aspirin-treated patients, and the incidence of central nervous system effects was less than in indomethacin-treated patients. In patients with juvenile rheumatoid arthritis, Tolmetin is as effective as aspirin in controlling disease activity, with a similar incidence of adverse reactions. Tolmetin has produced additional therapeutic benefit when added to a regimen of gold salts and, to a lesser extent, with corticosteroids. Tolmetin should not be used in conjunction with salicylates since greater benefit from the combination is not likely, but the potential for adverse reactions is increased. Half-life. Biphasic elimination from the plasma, consisting of a rapid phase with a half-life of 1 to 2 hours followed by a slower phase with a half-life of about 5 hours. Dose. Osteoarthritis. 200 to 600 mg POQ8HR. Not to exceed 1800 mg per day. Rheumatoid arthritis. 200 to 600 mg POQ8HR. Not to exceed 1800 mg per day. Safety advice. Tolmetin has been classified as pregnancy category X by the Federal Drug Administration, and the manufacturer recommends that for women of childbearing age, treatment with Tolmetin must not be started until pregnancy is excluded and it has been confirmed that reliable contraception is being used. That's all the information about Tolmetin we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.